You've just had a breast reconstruction using your own tissue. This is more than likely to be a DIEP reconstruction. That's when we take your tummy to reconstruct your breast. You may have also had a PAP reconstruction when we use your inner thigh or your back tissue, known as a lumbar perforator flap. Either way, what now? What's going to happen to your breast? What's going to happen over the next year? My name is Dhalia Masud and I'm a plastic and reconstructive surgeon, and I'm going to talk about what will happen to your breast over the next year. So what do I mean about reconstruction using your own tissue? I've already described in my previous videos, but this is when we take some fat and skin from another part of your body. We detach this from that part of the body and reattach it to the region of the breast using microsurgery. Now, this procedure can take several hours. So if you've just had the operation, well done. And I know you're feeling incredibly exhausted. You're probably tired. In the first 24 hours, you're likely to be running off a bit of adrenaline. You are emotional for having it done. Over the next 48 hours, you will be extremely exhausted. We will be checking your breast every hour on the hour to make sure everything is sounding okay and looking okay. And if we have any questions about what's going to be going on with your breast, we may have to take you back to theatre. But hopefully, most of the time, everything will be running smoothly. So what will your breast look like and feel like, or what is it looking like and feeling like in the first week or so? It will be swollen, and this is normal post-surgery swelling. It will feel a slight heaviness, and there may be areas where you will get some pinpoint tenderness. The areas that you may get some discomfort are the inner aspect of the breast. Now, I don't tend to remove any rib to reattach the breast, but some surgeons, and in some rare cases, I will remove a little bit of rib, and you can get a discomfort just on the inner aspect of the breast. Generally speaking, you should be feeling okay in terms of pain in the breast region. It may feel a little bit tight and discomfort where the drain site is. But hopefully, once the drain is out, this will settle down. Once we are comfortable with the fact that the breast has settled with its new blood supply, we will reduce the amount of assessment on the breast. So we won't be assessing you every hour on the hour. We'll reduce it down to 2 hourly, then 3 hourly, and maybe even 4 hourly. And once you are happy, and we are happy, we will stop the assessment of the breast, and providing you are mobilizing and walking around, we'll send you home around day 2, day 3 after the surgery. During this period, it's really important not to judge your breast. It will be swollen and it will be bruised, and we've already assessed that the colour and the blood supply is safe. That's why we've sent you home. In the first week after you've been discharged home, the physio will have given you some advice on what to do and what not to do. At home, in terms of the breast, the main thing you need to be doing is just generally keeping it warm, particularly in the winter periods. And if you have any pets or young children, it's really important that they are not jumping around you or near you, because you don't want them to be putting any pressure on your breast. When you see us in clinic in the first week, we will assess the breast, and your breast will still be bruised. It will be swollen, and along the stitch line, whether it be around the old nipple or along the old mastectomy scar, you may get some redness. And this can take a few weeks to settle down. I usually use glue, and that glue will slowly peel off in the first 2 to 3 weeks, but we will advise you not to rub this area and just to keep it nice and dry and follow the advice of the nurses. Again, still at 2 weeks, you are significantly swollen, and you may get some bruising in this areas, particularly where the drain site is. After about 3 to 6 weeks, the bruising should have settled, and the breast should be developing more of a soft texture to it. Occasionally, we may find at this stage we've got accumulation of fluid or seroma. Now, if this is a large amount at this stage, we may consider removing the fluid using a syringe and a needle. However, if it's a small amount and we are comfortable with it, we will leave it as it is and allow the body to absorb it. If we're unsure, we may send you for an ultrasound scan. The other thing to be aware of at this stage is the texture. Now, if we find that small amounts of fat is becoming swollen, or it's starting to become hard, also known as fat necrosis, this is when it will first appear. Now, if it's just a small amount, we will allow the breast to settle and advise you to massage to help soften this area. And with time, it will soften. If it is persistent over a long period of time, there will be things that we can do to help the breast. Now, at 3 months, you should be starting to develop the shape and the size, and we will get a little bit more idea about the volume. However, we have to wait the full year for the final volume to settle down. Now, between the 6-week mark and the 3-month mark, we may decide that you need to have some radiotherapy. Hopefully, most of you, we would have known that you need radiotherapy. However, for some of you, it may come as a bit of a surprise. Now, if you have radiotherapy, what will happen to your breast? If we will be applying radiotherapy to your breast, what will happen to it? The radiotherapy can change the skin color and skin texture, so it will appear red. And in some cases, patients may develop hardness of the breast, which takes a little bit of time to settle. Now, it's very unpredictable who will have a change in breast shape after they've had radiotherapy, so we will keep an eye on you, and we have to wait at least a few months before we see the results of a radiotherapy breast. After 3 months to 6 months, the breast will continue to settle down, and you will have some pulling sensation in the areas where the stitches have been used to secure the breast into the breast pocket. This will hopefully settle with time, but because you have had a mastectomy, there are symptoms associated with the mastectomy as well as the reconstruction, which will be apparent by this stage. And these are numbness. So we know that you are going to be numb no matter what we do. And that numbness will be along the breast or altered sensation and numbness underneath the armpit. So you will have numbness underneath the armpit. What this means is as the breast settles down, when you have a numb breast or a numb part of the area, it feels bigger than it actually is. And sometimes for some people, it feels like they're carrying something underneath the armpit. And this, unfortunately, is part and parcel of the mastectomy procedure. Even if you have a breast volume that's very similar to the opposite side, it does always feel slightly bigger. On top of that, when you choose a bra, because of the numbness and also the scarring, it can feel different or strange, and you may find it difficult to find the perfectly comfortable fitted bra just because of the irritation of the scar. And a lot of ladies may just find that having a soft cup over the top bra suits them the most. And that is part and parcel of the reconstruction surgery. By the time we hit a year, everything would have settled down and we will decide whether you need to have any further surgery. Now, that might mean uplifting the opposite side or doing further fine-tuning in the breast. Now, if you've had radiotherapy, this will be a very judicious approach to surgery because you do have a high risk of infection when we do operate on radiotherapy breast. And we do have to wait the full year before we make any decisions about operating on that breast. So let's talk about the opposite breast. Some patients, I may choose to do a breast reduction at the same time as your DIEP reconstruction. This may be for 2 reasons. A, you want to be smaller, so we will give you a smaller breast. This may be because your breasts currently are quite uncomfortable and it can be difficult to examine, particularly with your history of breast cancer. Or you do not have enough fat to match your current breast, so we will do a reduction. What does this mean for your reconstruction? If you are having a reduction on that side, the reduction side will settle quicker and drop quicker than your reconstruction side. So there will be a period where you will be slightly off kilt. So the reduction side will drop first, and the reconstruction side will take much longer, up to a year, before it matches the reduction side. Once we've reached the year, we will decide whether we need to do any fine-tuning. Now, if you are having radiotherapy, it can take a little bit longer for the breast to settle down before it reaches its final stage. But have a chat with your surgeon before you come to a conclusion of what to do next. Now, once you've got to the 1 year mark, what will your breast feel like? What are the permanent things that will be happening to your breast that you need to be aware of and you need to accept as part and parcel of the reconstruction? The first one is numbness. Numbness is part and parcel of the reconstruction because of the mastectomy and all the nerves being disrupted and being removed as part of the surgery. And that numbness, as we've already discussed, will be an altered sensation in the actual breast. Some patients may have some sensation in the breast, but it will generally be altered, and you will likely have some numbness on the underside of the armpit. This is part and parcel of the procedure. The other aspects of the DIEP reconstruction is you may have had axillary clearance, that's when we remove the node, or a form of sentinel lymph node biopsy when we take a sample of the node underneath the armpit. We've also secured the breast in specific points. And what that means is in those areas you can develop scarring. Now, for a lot of people, massage can help the scar settle. But for some people, this scarring and the pulling sensation can be a long-term component of the surgery. So every time you move your arm or move your shoulder, you may feel the occasional pull or twinge, which is part and parcel of the surgery. Now, if you feel a lump or if it is a new pain, this is something that you need to have investigated. But generally speaking, the occasional pulling sensation when you do something is part and parcel of this reconstruction. We may do a nipple reconstruction at the same time as your DIEP reconstruction. And if you have a nipple reconstructed, what you may find is sometimes they can flatten out. And if they do flatten out, we can consider reconstructing a new nipple, or we can leave things alone. But you would have had a tattoo as well at this point, hopefully, which will need to be topped up regularly over the next few years to give it the same colour that you want to attain. Because it's your own tissue, it will change as your body changes. So if you put on weight, the breast will increase in size. If you lose weight, the breast will reduce in size. And this is why we always advise when you have your operation, we maintain a healthy weight and a weight that you are able to maintain long term, because any change in weight will affect the breast. Now, if you've had radiotherapy, you will have long-term changes in the redness of the breast. You may have some veins or vessels appear on the skin, and this is part and parcel of the mastectomy skin or the breast that has been affected by radiotherapy. If you do have any new changes, like I've said, anything new, any new lumps, you need to have that assessed. Now, with radiotherapy breast or reconstruction, it does behave very differently to someone that doesn't have radiotherapy. The long-term effects of radiotherapy can be very long-term, so you may get new changes even after a year, and it does take significantly longer to settle down. In areas particularly underneath the armpit, you may get a little bit more tightness and pulling sensation because of the effects of the radiotherapy. And if this is significant and is stopping you from doing your normal activities, have a chat with me or your surgeon, and we can see if there is anything we can do to help improve this. But generally, what does definitely help is massaging this area to help soften the scar. I hope this video helps you and provides you with some of the information that you may need to help deal with the changes in the breast after a reconstruction. If you or a loved one or a family member are going through the journey of reconstruction, share this video and hopefully this will help them also. In the meantime, thank you for watching till the end, and hopefully we'll see you in the next video. Bye.